Standard precautions are the minimum infection prevention practices that apply to all students, regardless of suspected or confirmed infection status, in any setting where first aid or healthcare is anticipated or delivered. These practices are designed to both protect and prevent the spread of disease among students, children, and staff. Standard precautions are easy to practice. Number one, and you hear this all the time, wash your hands. Wear gloves if you handle blood or body fluids. Make sure you clean contaminated areas correctly using specified detergents and infection materials and protocols. Cover your cough and dispose of waste appropriately. How you wash your hands is important too. We know you know this, but just to reinforce it, here are some guidelines. You should first wet your hands with warm water, then apply liquid soap, and make sure you lather for at least 20 seconds outside the stream of water. Make sure to get the back of your hands under your fingernails and then rinse well. Dry hands with a paper towel and turn off water using a paper towel instead of bare hands. Department of Public Health and Environment sanitation rules for child care allows the use of bar soap. Using bar soap, though it allows it, using bar soap is discouraged as bacteria can grow in the bar and the soap dish. Always liquid soap is preferred. It is not mandated at this time, but it is preferred. So we know hand washing is the single most effective way to prevent the spread of germs and infections. It is important to remember when to wash your hands throughout the course of the day while in school, in a school or in a child care setting. For example, when you first arrive for the day or when you're changing between classrooms, of course before you eat or handle food or feed children, of course after toileting or diaper changing, after touching blood or body fluids, or when coming in from the playground. Also make sure you're washing your hands after touching any pets or like pet cages, after water play or sensory tables, of course whenever hands are visibly dirty, and then also before you administer first aid or medication, as well as when you're in the process of cleaning and disinfecting objects, even if you wore gloves. After removing your gloves, just because you wore the gloves does not mean that your hands are clean. Another idea is before you go home for the day, so you don't take any germs home to your family. And remember, children should also be washing their hands at these times as well. So the best and most effective way to wash your hands is with running soap and water. This is much better. I know a lot of places for a while really got into hand sanitizers. Soap and water is so much better than hand sanitizers. Keep in mind that hand sanitizers may contain alcohol and can be dangerous to young children. They should not be in the reach of young children and should be not used on children younger than 3 years of age. The only time suggested really to use hand sanitizer is for yourself or children older than 3 years old, and only when running water and soap are not available. If you have to use hand sanitizer, please follow the product label instructions and always wash your hands as soon as possible using running water and soap afterwards, as soon as that's available for you. Never use hand sanitizer and gloves to clean them for reuse. The hand sanitizer of the glove and the gloves are for one time only, and the hand sanitizer can ruin the gloves and break down the integrity. Always wash hands with soap and water after any time you remove your gloves as well. So just keep in mind, hand washing, hand washing, hand washing. PPE, personal protective equipment. This is used to keep your clothes clean in case of splashes, sprays, and may protect you from potentially infectious blood or other materials. These PPE include gloves, CPR masks, and other items you may use to cover and protect yourself. Remember, removing personal protective equipment, it's important, especially like with gloves, that you're doing it correctly. So this little diagram is here designed to help guide you through the process. Some people suggest if right where you have gloves in your health room or area, you might have one of these just to remind you of the proper procedure. Just remember, it is really important that you follow these steps completely, then dispose of gloves safely, and then wash your hands immediately. It seems to go without saying, but better protect yourself. Don't eat or drink or apply makeup or handle your contacts in the same area where you may be providing medications or first aid. This is to protect you from any contamination of potentially infectious material. So diaper changing. You should try to change a child in a stall or a changing table in the bathroom when possible. Be sure to keep the child safe by placing a hand over them while on the changing table, and keep all disinfectants secure and out of the reach of the children. The following procedure shall be conducted each time a diaper is changed. Number one, have all the supplies needed for the diaper changing placed at the diaper changing table before the child is brought in there. Number two, individual changing diapers shall place a new pair of gloves on hands prior to changing the child's diaper. Number three, the child shall be placed on a clean, disinfected, dry changing table or mat. Number four, the child shall be cleaned on the body wherever necessary. Number five, soiled clothes shall be placed in a plastic bag for parents or guardians to take home. Soiled diapers shall be placed in a covered, plastic-lined receptacle. And number six, if topical ointments are applied, clean gloves shall be donned and put on. Gloves shall be removed before handling clean clothing and diapers. Then after you're done, number seven, wash the child's hands. At number eight, the child then may return to a clean crib or to play. Number nine, the staff member shall then clean to remove the visible soils and disinfect the following areas: the diapering area, the equipment, supplies, and any other surfaces or furnishings contaminated possibly with urine or feces. Number 10, the staff member shall then thoroughly wash his hands, as we've described before, using the proper procedure. And then number 11, soiled cloth diapers shall be immediately placed in a waterproof bag after being removed from the child, and shall be stored in a covered diaper pail for return to the parents, guardians, or diaper service, or until laundered. Soiled cloth diapers or clothing shall not be rinsed in our facility. When handling any laundry, including clothes, which is contaminated with blood or body fluid, you should wear gloves. And as tempting as it may be, do not shake out the laundry even to empty stool from cloth or diapers. Just leave them as they are and bag them up. The health department regulates the temperature at which laundry must be washed. If your staff takes laundry home to wash it, it has to be washed separately from their personal laundry and brought back in a clean container. Contaminated sharps. Needle sticks are uncommon in schools and child care programs. However, keeping yourself and those around you is important. OSHA defines contaminated sharps objects as things that can penetrate a worker's skin, such as needles, scalpels, broken glass, tubules, and exposed ends of dental wires that are contaminated with blood or other potentially infectious materials. Be sure to store the sharps container out of the reach of the children. Containers for contaminated sharps must be puncture resistant, and the sides and the bottom must be leak proof. They must be appropriately labeled or color-coded red to warn everyone that the contents are hazardous. Containers for disposable sharps must be closable, that is, they have a lid or flap or door, other means of closing the container, and they must be kept upright to keep the sharps and any liquids from spilling out of the container. Sharps containers can be ordered through Jeffco Health Services. There's a number that you can call for them to come, and environmental services will go ahead and change out if your sharps container is getting 3/4 of the way full. If you need that information, please contact your nurse and she can help you out with that. But we do this all internally through Jeffco handling the sharps. Your program should be prepared and make plans before an incident happens where blood or body fluids may be present. Part of this plan needs to include having supplies readily available. Many schools and child care programs have combined these supplies into what's called a spill kit. This kit contains all needed cleaning and disposable supplies and places them all together in a very convenient place for you. A hint that is suggested is a beach bucket set aside from a discount store to keep all your stuff together might be a way to gather it up in a cheap, inexpensive way. Who's responsible for the cleanup? Programs use different models. It's important for us to discuss at your preschool site, but usually we'll go ahead and speak with facilities management to go ahead and have them come in and help you clean and contaminate and disinfect properly. Keep in mind that facilities managers will probably be working with you on this, but just so you're aware, when there is cleaning, you're going to wear gloves to protect you from infectious diseases. And also, gloves will protect you from the chemicals you potentially may use for the cleanup or sanitizers and disinfectants. So use gloves, and when cleaning, physically remove all dirt and contamination. For example, countertops after each use or food preparation appliances. Sanitation, it reduces germs on inanimate surfaces to levels considered safe by public health codes or regulations. For example, food preparation surfaces after cleaning and eating utensils and dishes after cleaning. And then disinfecting. This destroys or inactivates most germs on an inanimate object, but not bacterial spores. For example, changing tables after each use and after each cleaning, hand washing sinks and faucets daily after cleaning. And then disposal. This removes the contaminated items from the area and properly disposed according to JEFCO policies. So let's start off with that cleaning piece. The purpose of cleaning is to physically remove all dirt and contamination. The friction of cleaning removes most germs and exposes any remaining germs to the effects of sanitizer and disinfectant used later. Sanitizing, remember you're going to have to use EPA registered product, and the purpose of sanitation is to reduce germs on surfaces to levels considered safe by public health codes and regulations. Sanitizing in kitchen or other food service areas on surfaces that come commonly into contact with food, hands, the mouth, eyes, nose, and exposed skin of children and staff. These surfaces include, but are not limited to, kitchen surfaces, infant food preparation areas, pacifiers, drinking fountains, tabletops, keyboards, toys, sleeping mats, cribs, high chairs, headphones, tumbling mats, and furniture. Sanitizers are not to be used in place of soap, detergents, or other cleaning compounds that are intended and used to remove soil from surfaces unless specifically formulated as a cleaner sanitizer. Don't forget, bleach solution must be tested upon mixing and then daily. Follow manufacturer's labels instructions for dilution and contact time requirements. Disinfecting. Once again, you need to use an EPA registered product, and the purpose of disinfecting is to destroy most germs on any object or inactivate them, but not bacterial spores. Disinfect any surface contaminated with blood or other potentially infectious material, OPIM, such as toilets, diapering areas, areas contaminated with blood or vomit, and remember to check the product label and use it according to the directions, ensuring proper dilution and leaving the solution for the proper amount of time for it to disinfect, so leaving it on for the right amount of time. You may need to contact your local health department for safe dilutions and contact times. And here's a little hint to remember the difference between sanitizers and disinfectants. Remember, sanitizers are safe for food contact surfaces and toys. Disinfectants are dangerous. They're strong and are for blood or OPIM. And don't forget, bleach solutions must be tested upon mixing and then daily. Follow manufacturer's label instructions for dilution and contact time requirements. There are two types of waste. The Bloodborne Pathogen Standard uses the term regulated waste to refer to the following categories of waste which require special handling. This is things like liquid or semi-liquid blood or other potentially infectious materials, OPIM, or items contaminated with blood or OPIM, which would release these substances in a liquid or semi-liquid state if compressed, or items that are caked with dried blood, or OPIM, and are capable of releasing these materials during handling, and then, of course, contaminated sharps, as well as pathological and microbiological waste containing blood, or OPIM. So let's give you a little test here and review how you're doing with learning all this material we're giving you today. So what would you do? You have a student in your care who has a nosebleed. The blood gets on the floor, and after you care for the student is most important to what? A, B, C, D, E, F, or G? So test yourself here. The correct answer is actually E. Since blood is present, cleaning and disinfecting will remove the bloodborne pathogens from the exposed area. Hopefully y'all got that right. So here is another test. What would you do? You have a student in your care who vomits on a shelf where toys are placed. After you care for the student, it is most important to A, clean and sanitize the toys, B, clean and disinfect the toys, C, clean and disinfect the toys and shelf, and then wash, rinse, and the toys sanitize them, D, clean and sanitize the toys and shelf, then wash and rinse and the toys and disinfect them, and E, none of the above, just walk away. The correct answer, well, I'll see if you guys have tested yourself here. The correct answer is C, because children could mouth the toys. You never want to leave the disinfectant on the toys. In this scenario, because vomit got on the toys, you need to clean them, then disinfect them, but then you need to rinse off the disinfectant and sanitize the toys. Remember, the disinfectant is dangerous for children to handle or put in their mouths, but sanitizer is safer for them and is appropriate for use on tables, toys, and skin contact surfaces.